Hello. My name is Rachel Kaminsky, and I'm one of the founding members of Get the Lead Out Rewards Philadelphia. And I would like to tell you a little bit about our group. Our mission is to end childhood lead poisoning by advocating for responsible demolition and excavation, increasing blood testing rates, ensuring intervention services to any child with elevated levels, educating caregivers of children from 0 to 6 years old, and ensuring playgrounds and public spaces are lead-free. Get the Let Out Rewards started as a small group of concerned parents in 2017. When the Inquirer released its article, Toxic City, Tainted Soil, that article touched upon lead found in the demolition activity in our area and the lead still present in our soil. Philadelphia, like many cities in our country, has a lead problem due to its older housing stock, former use of lead gasoline, the highway running through neighborhoods, old pipes, paint, and its industrial past. There's lead everywhere. Through our advocacy, we have worked with the Department of Environmental Protections, License and Inspection, Air Management Services, state representatives, and the Health Department to set up multiple meetings about the Anzon site, a former galvanization site and a lead hotspot located in the old Richmond section. We publicized the amount of lead found in the ground, had a remediation plan of said lead, and what the next steps would be taken. We were first to find out that 4 fields in Philadelphia's playgrounds were contaminated with high lead levels in 2019. Chew in Point Breeze, Heitzman in Harrogate, and Samuels and Montkevich in Port Richmond. We were the first to contact the Philadelphia's Park and Recreation Department to demand an action plan and when they would be notifying the public. Our group has also held the city accountable for making sure their lead surveillance reports are up to date and released on time. Question when Philadelphia would meet the CDC's updated blood lead level standard. We have taken upon ourselves to work with the Agency for Toxic Substances and Disease Registry, the Environmental Protection Agency, and the Center of Excellence in Enterprising Toxicology to run soil testing events. We have also used our knowledge in order to gather soil samples from sites from people that had concerns about and get them tested. Our group was able to speak to the DEP, L&I, Air Management Services, and City Council to address demolition dust concerns, advocate for stronger regulations, and we also worked with the Health Department to add soil as an area of concern when it comes to lead poisoning. Get the Lead Out also testified in favor of Representative Isaksen's public hearing on Childhood Blood Lead Test Act and spoken out against the administration of the Land Recycling Program bill, which wanted to increase the standard of lead in non-residential soil. We also worked with Public Citizens for Children and Youth, now Children's First, to help strengthen Councilwoman Blondell's Philadelphia landlord lead laws and rallied at City Council to ensure that it passed. Despite all the work that we've done and continue to do, the uncomfortable truth is that we are all in the shadow of lead's historical legacy. We live with it daily and sometimes forget that it's even there. It is an unseen danger that people react to once it's too late. For instance, Janet Curtis, another of our founders, is a mother who had her backyard tested by a non-city agency, and the results were alarming. Her yard was found to have lead at 1,100 parts per million, which is nearly 3 times the federal limit. Janet quickly had her then 12-month-old daughter's blood tested. The results showed that her child had tested positive for lead poisoning. It was almost 3 times the amount of what Philadelphia had as the level of concern at the time. This heartbreaking turn of events was due to the lead in her own backyard. She is one of many members with similar stories. Every year, over 2,000 Philadelphia children are diagnosed with lead poisoning. The CDC states that no amount of lead is safe. It is all harmful. The risk factors for lead exposures are problems with attention, memory, behavior, self-control and stress management, also decreased IQ, hearing, and growth. In higher exposures, it can even lead to aggressive behavior, brain disorders, and seizures. However, you may not see an immediate change. It can be an invisible poisoning that you don't realize is happening until there's a long-term exposure. Those who are most at risk are children from the ages of newborn to 6 and women who are pregnant, as the fetus can also be exposed to lead if the mother is. Despite these facts, we hadn't found much outreach to prevent lead poisoning in the first place. Like a canary in a coal mine, children are usually poisoned before a person knows to check for lead. This is tragic because lead poisoning is 100% preventable if you know where the lead is. We began to advocate for a proactive approach instead of a reactive one, enabling getting this information into the hands of expecting mothers. After hitting a lot of roadblocks, we worked together with Philadelphia Regional Center for Children's Environmental Health, Perelman School of Medicine, Children's Hospital of Philadelphia, Children's First, and the Foundation for Delaware County, and together we created Prescriptions for Prevention. These are broken up into prenatal lead and postnatal lead exposure, lead in the home and lead in soil, as well as a lead safe checklist. Each comes with QR codes to websites where you can get more information. Not only are these posted on Philadelphia Regional Center for Childhood Health website, we have posted them on our social media pages and our partners have shared them as well. Our goal is to get people to think about preemptively testing their home, yards, toys, etc. for lead, just the same as they baby-proof their home. Lead testing should be just as common as child locks, outlet covers, baby gates, securing heavy furniture to the wall, corner covers, and cabinet locks. The science is clear. There is no safe level of lead. Even small amounts can be harmful. The historical approach to lead awareness has been too reactive, and our children are put at risk as a result. Thank you so much.
Well, I'll introduce both people who are on the screen. One is Jerry Roseman, who's the director of the Philadelphia Healthy Schools Initiative, co-director, and also Susan Gabreski, who is a key contributor to that organization, as well as our work on the asbestos program, the asbestos work that we're doing in schools. So I'm going to, at this point, turn it over to Jerry.
Thank you. Can you hear me, Marilyn?
Yes, yes.
Okay, great. So Susan and I are going to work kind of together because we're far apart right now. Susan's in Philadelphia and I'm out of the country. And so she'll be doing the slides and I'll be talking about it, and hopefully these two things will align. So my name is Jerry Roseman. I'm here with Susan, and both of us have worked together closely with Dr. Howarth and the PRCCH on an asbestos in schools translational science effort. My primary practice is built around the public health framed occupational, environmental, and building and data science set of approaches. And I've had an opportunity to conduct thousands of site visit assessments of building, facility, and environmental conditions as part of that work. I spent the first 5 years of my career as a regulator, and since then I've worked as the director of environmental science for a core school stakeholder, the Philadelphia Federation of Teachers, and as one of the co-directors and an environmental science advisor to the Philadelphia Healthy Schools Initiative, as well as to the National American Federation of Teachers as well. I'm currently on the board of the 21st Century School Fund, a DC-based advocacy group that's focused on school funding for facility improvement. And I've worked with legal advocacy organizations in the same space, including the NAACP, on major school facility and environmental condition cases where issues of deteriorated K-12 school conditions and serious environmental hazards intersect with issues of race, poverty, and environmental justice. A quick note here is that I'm somewhat unique in that the work primarily that I do is with directly impacted core stakeholders, including labor unions, parents, and community and advocacy groups representing those directly impacted who often don't get technical assistance and support. My approach is informed by several principles, including the precautionary principle, ideas embedded in the workers' right to know and right to act initiatives, and community-based participatory research, as well as notions from action-oriented research, which the CDC's NIOSH, OSHA's research arm, refers to as their research to practice approach, an R2P approach. As an example, recently I worked with Penn Environment, the Public Interest Research Group, and the Black Church Center for Justice and Equality, analyzing school district water quality data to help summarize and highlight major lead exposure issues and concerns for the purposes of raising public awareness and helping to advocate for and pass legislation to lower the allowable level of lead in school drinking water. Both the Philadelphia Federation of Teachers and the Healthy Schools Initiative have been supporting and working with the PRCCH since its establishment. And we very much appreciate being able to collaborate with the center, and especially with Marilyn, who I've known and worked with for many years, and who's been an incredible resource and a dedicated professional who has made important and lasting contributions to the work that done in the fields of occupational environmental medicine, health, and safety. My goal today is to provide a very brief overview of the work we've done to address school conditions here in Philadelphia and more broadly, including a focus on a tool we developed to help document conditions, empower core stakeholders, assist experts, and drive action. The Philadelphia Healthy Schools Tracker, launched with the teachers union here, is an environmental and condition problem reporting mobile and web app. The app is a crowdsourcing citizen science tool specifically created to help school staff and students, those directly experiencing facility condition problems in the as-built environment, to report, document, track, and ensure problems at the room, school, and district levels are properly and accountably addressed. The app has successfully facilitated core stakeholder engagement in education and empowerment, and has resulted in better participation in data collection and confirmable solution implementation. We'll take a look at this in a little bit. The work we've been doing, and especially the mobile app tool, is also closely aligned, I believe, with the translational science support work currently being done by us with PRCCH. School conditions, since we're going to look at this for a moment, but very briefly, because I know this group is very familiar with the hazards children face from inadequate school environmental conditions. So I just want to highlight a few critical issues. Philadelphia has one of the oldest and most deteriorated school infrastructures of any district in the country, with legacy hazards such as asbestos and lead in both paint and water in more than 100 buildings and in thousands of student-occupied spaces. These conditions exist, of course, across the country, particularly in older, poorer districts with higher concentrations of people of color, many of whom also face disproportionate and additional environmental health threats in their own communities. In addition to asbestos and lead, mold, problems associated with pest infestations, indoor air quality issues, failing building systems, and deteriorating physical conditions all present potential harm to students and staff health, safety, welfare, and comfort. You can see some of this in this image that we're showing here from high school in Philadelphia. Adverse impacts are often additive and sometimes even synergistic in nature, and many of these problems are longstanding, exist in plain view, and are too slowly and poorly responded to. These are also problems we largely know how to fix. Now, answering the questions, how did we get here and what do we need to do now, requires us to consider two major concerns. One is the need for more stable and equitable funding for school infrastructure. About this, there should be no question. But there is another major issue needing significant improvement, and that is the need to upgrade operational management related to school facilities and environmental conditions. Glaring problems, including the stunning lack of basic standards for adequate school facility and environmental conditions, significant limitations with consistent, comprehensive, and systematic data collection, transparency and communication, and the failure to substantively engage and involve core stakeholders in ways that build and promote public trust and confidence, all must be urgently addressed. Before jumping into the details of the mobile app, I'd just like to share a couple examples of how the mobile app reporting has and can be used to highlight problems that might otherwise be allowed to persist. This slide highlights reporting from two separate elementary schools. The classroom on the left shows severely damaged paint, in which the reporter stated this condition was present throughout the school and expressed a concern that the paint might be lead containing. The picture on the right shows an elementary school gym with a young child sucking his thumb while hanging on what turned out to be an asbestos insulated pipe, documenting the presence of a dangerous environmental condition very accessible to young children and in particularly high activity locations. Having conditions like these publicly reported, documented, and shared makes a difference and made a difference in the assessment and remediation response timing and scope. These conditions had existed for some time. The second slide is really a perfect use case for the development of the mobile reporting app. It came to our attention there was a persistent mold issue associated with elevated humidity and other adverse physical conditions in an elementary school in the Logan section of Philadelphia. You can see the mold covering the entire classroom ceiling. Multiple reports from the school staff to district administrative and maintenance personnel had been made, but the problem reportedly persisted. There was frustration by staff about a lack of response over a period of many months, and also about the fact that there was little information provided about whether any inspection had been done, and if so, what had been determined, what kind of work was scheduled, and when it would be started. The PFT's Healthy School Tracker Problem Reporting app is designed to facilitate systematic, trackable reporting with updated remediation work and activity status provided in an accountable and confirmable manner, as we're going to see. Serious physical condition problems with ventilation, roofing, plumbing, and electrical systems have both direct as well as consequential and cascading impacts from leaks, lack of adequate air quality, thermal control, and mold growth. Identifying and responding to these problems early on and quickly has multiple benefits in addition to protecting the health, safety, welfare, and comfort of students and staff. So before spending the rest of the presentation on the mobile and web cloud-based problem reporting app being used, I have one final set of comments about our primary focus on three major programmatic elements. The first is a focus on the critical need to develop adequate building condition standards. The second is implementing radical improvement in data and information quality, consistency, comprehensiveness, sharing, and transparency. And the third is devoted to ensuring the voice of core stakeholders is heard and that they have a seat at the planning, priority setting, and solution finding tables and are enabled to fully participate with school board and district leaders and managers. Only by doing all of these things do we believe will public trust and confidence be able to be rebuilt, and that we have the best chance of success in promoting an effective and sustainable initiative to improve facility and environmental conditions in all our school buildings. So the problem reporting app, in developing this type of problem reporting tool for K-12 schools, we wanted to address several issues to allow core stakeholders, including parents, teachers, students, and community leaders, to document and report problems related to the as-built conditions they experience day in and day out. We wanted to provide a guided reporting experience to collect essential information about problem locations, type, and scale in order to develop a much better understanding and a richer understanding about how the experienced problems impact people and the educational mission. We tried to enable reporting that simplifies, streamlines, and demystifies the process of documenting issues with a user-friendly interface, and to promote broad data transparency and to facilitate communication about problem impacts and repair status, and to allow stakeholders to learn from each other's experience and to track what's actually happening. The app also can serve as an early warning system for identification and reporting of problems when they start, and may be easier and more effectively addressed. The images that I showed earlier kind of highlight that. We wanted to build a data set that can be aggregated and analyzed by problem type, severity, and location within and across schools, representing the as-experienced reality in the built environment from those who are working and learning in these schools. And the union, representing school staff, and has useful and timely information about school conditions, which is otherwise very difficult to obtain, and which can be used by the union to take action to drive response, which can be challenging for individual teachers to do. So we're going to look at an example of the Android version of the mobile reporting app. We're going to take a look at the way information is collected and used. So in this short video we started, we're going to show a look at how this app on the Android system is going to be very much like on Apple and on the web app. Once you've launched the app, you'll see whatever problems, if any, you've previously reported. You can then pick the problem that you want to, the problem type that you want to report. You can take a photo of that problem and add images and information. Once the information is submitted and you have entered the school and the room and the floor, The report can be, is automatically populates an admin site, which we'll take a look at. You can also report another problem by just hitting the plus report button on the bottom of the page. Reports are then reviewed, edited, modified by users and admins. So if there's information to put in, that can be put in after the fact, additional photos and other information. And the reports are shared with the School District of Philadelphia's Operations, Maintenance, and Environmental Management departments so that status and remediation work can begin. Photos, videos, and other information can be quickly updated. And every time there's a status change or an update, a push notification alerts the user, whether that's made by other users or by the school district. Completed work as listed by the district needs confirmation by the reporter for accountable solution closure. This is the web reporter version of the app. So very similar, one page, and does really the same thing, allowing for a problem report to enter the same kind of information. And here, of course, you're normally working on a computer, so you're not going to be taking a photo, but you will be grabbing one from your photo library and you can upload those images. Now, once the report is submitted, it immediately populates the main admin site, which you're looking at here. Initially, all the reports are available to the union admins, but not at first to the school district until they are accepted, which is a vetting process. The reports that are waiting for and need to be accepted can be seen here along the top. They have an accept tag on the top right of each of the cards. This can be seen with Palumbo, Fitzpatrick, Ziegler, and Randolph. Each problem report card displays the school name, problem location, as well as a status summary and date of the assigned status, and a color-coded badge listing the reported problem category and an indication about existing photos, if any. The admin site provides aggregated information. At the top of this screen, you can see the total number of problems to date. There have been, unless this got cut out of here, I'm sorry about that. There have been about 5,000 problems reported so far. You can see the number of schools that have reports from them. There are also several filters that can be employed and a map view for the problem reports that can be toggled to display results by neighborhood, census tract, environmental justice zone, learning centers, councilmanic districts, and that kind of thing. Once the problem is reviewed and accepted by the union, the problem report immediately populates the school district interface that we built, which is an exact copy of the union side, but without providing identifying data about the problem reporter. So what we can see here, if we take a look at the next slide where we have a map version, one of the other ways to look at this is to look at this as a map version where we can see the size of bubbles. That this is obviously a static version and needs to be scaled a little differently given the version that we're looking at right here. But for each of the bubbles, the size of the bubbles reflects the number of problem reports. And if you hover over a bubble and click on it, like we're doing here with the Southwark Elementary School, we can see a chart that shows the number and distribution of problem reports for that school. Also at the top of the school, this slide it shows you the ability to assign a specific role for the problem reporter. It could be a teacher, a parent, a professional, a school district representative, and there's the ability to assign problem categories or priority categories: immediate, urgent, important, or moderate. So we can interact with these app reports. The teacher staff engagement in using the mobile app and in advocating for improvement in the building environmental and facility conditions has definitely increased over these years. And there have been a number of occasions where work has been initiated just because of the problem app reports that are made, even though there is a work order system in place. We've been able to better understand what happens to staff concerns and complaints that are made through the more established district channels and how they differ from the problem reports through the mobile reporting app. The staff has liked the much more robust follow-up, tracking and updating of status going on through the app. Normally, there's no feedback loop to the people in buildings who are experiencing these conditions. And we've been able to demonstrate that coordination and collaboration with the school district is not only possible, but productive, although there remains a lot of room for improvement. The data visualization slide that we've included here is just to give an idea of some of the analytics and data visualizations that we've been working on. And so we've developed a large number of dashboards, of course, and many other ways to look at the data and think about it. And we do this with the stakeholders and with community organizations. Here we're showing a map view of the Philadelphia School District with circles, each representing clusters of school buildings, and with the total number of problem reports for that cluster of schools. We can easily separate out the problem reports at the individual school levels and filter problem reports by type of report, school level, and other metrics. Along the right-hand side of this slide, we're showing a number of metrics, and we can vary and change these in all kinds of ways, of course. And here we're showing the total numbers of problems, total numbers of schools, numbers of reporters, status of time it takes to fix these problems, those kinds of things. And at the bottom of the slides, we're demonstrating a couple of the other ways that we are right now actively filtering and displaying mobile app and report data to help people better visualize and understand what is going on. So, our next steps, we definitely have a lot of work ahead of us. We know what our school conditions are here in Philadelphia, across Pennsylvania, and around the country. And what we are working on is to work both with the teachers union here, community groups, and the school district to greatly increase the utilization and engagement of the app. We want to engage in deep dive data looks to see what else might be revealed about the kinds of problems that are being reported. We're developing additional data analytics to come up with more sort of power and ways to push the solutions ahead. We're planning to engage, and we have, in upgraded training and education of school staff and parents and others who are engaged in using the app and participating in solutions. We intend to create public-facing update reports based on the mobile app reported data. We're looking to develop additional functionality and develop a national version of this app. And we recognize and want to highlight here that this kind of mobile reporting app is only one piece of a puzzle. It's one that is left out, but it does provide a snapshot view of real-time experienced issues that is important. But there's a lot of systematic data and information collected by districts and others that needs to be aligned and blended with this for us to have a full picture. So in closing, I'd just like to say that there's obviously a lot to talk about. This is a brief version of what we're doing. And I'm always happy to arrange a longer discussion to discuss the urgent need to improve the information that's available to people, ensure it's actionable for stakeholders and their allies, and to make sure that people who deserve a seat at the table are given an opportunity to participate. We're really grateful to Dr. Howarth and the PRCCH for the collaboration and commitment to a shared mission. Thank you very much.